of all the miasms, Psora, which is functional. Now I'm going to read something from the Hahnemann's miasmatic book, Chronic Disease, and you tell me, you all are smart enough, all are good homeopaths, right? You all have to tell me whether the thing, the keynote that we're using, that Psora is functional, is it correct or wrong? Not. This is what is written in Nature of Chronic Disease. I will read it slowly, and I want you to also read it. He says that this observation, means his observation, taught me that not only the most of the many cutaneous eruption which Villian was an allopathic skin doctor who used to give different diagnosis name. Okay. This observation taught me that not only the most of many cutaneous eruptions which Villian distinguishes with such extreme care from one another and which have received separate names, but also all the adventitious formations. Listen to me carefully. What he's saying? He's saying that all the cutaneous eruptions, all the diagnose, all the nosological names of the diseases, you call it eczema, tinea, whatever, that allopathic doctor refers to, that comes in the list of Psora. But not that only. He says, but also all adventitious formations. Now, what is adventitious formations? Can somebody say what? Know the meaning of this? Unexplained outgrowths, formations, right? Outgrowths, it pops out, right? So kind of, even what is included in that, any outgrowth which is there, or your tumors come here, dear. He says all the outgrowths, adventitious formations along with the cutaneous eruption, from common wart on the finger up to the largest sarcomatous tumor, from a small wart to a huge tumor, it all comes in the range of Psora. From the malformation of fingernail, the little malformations of fingernail, up to the swellings of the bones and the curvatures of the spines. Can you imagine where is how deep is the reach of Psora? He's saying that fingernails up to the curvature means he's talking about the bone marrow destruction actually. Till that level Psora works. And many other softening and deformities of bones, both at early or at more advanced age, are caused by Psora. Just reading this paragraph, don't you feel Psora is very difficult or dangerous? What is your opinion? It is scary. My God, this is Psora. Oh my God. But I was thinking Psora is functional. Psora is some deficiency. If he is having deficiency, he can take vitamin D, he can take supplements and he can get better. Why he has to take homeopathy? He can do diet changes. This is Psora. That's why Hahnemann said so many adjectives. You can add some of them. Hydra-headed, multifolded, multifaceted, mother of all disease. Right? Let's go ahead. I was astonished, when I read this. I was really astonished. And I cannot thanks Dr. Ashok Borkar. Whenever I take this lecture, I always take his name because he's the person who actually pointed out these things to me. He was the one person who said, Manish, go and read chronic disease. I said, no, sir, it is very boring. He said, you read, please read. He was a person who pushed me to read Allen's miasm. So I'm really thankful to him. I'm really thankful that because of his zeal and his understanding, I got this wisdom and I'm able to transfer it to the next generation. So thank you, sir, if you're listening to me. I don't know if you're there, but what else? He doesn't stop there. He says chronic ulcers, inflammations, sarcomatous enlargements, tumors, emaciation, excessive sensitiveness, as well as deficiencies in the sense of seeing, hearing, smelling, tasting, feeling, excessive as well as extinguish sexual desire, disease of mind and soul, from imbecility up to ecstasy, from melancholic up to raging insanity, swoons, vertigos, so-called diseases of heart, abdomen, all that is comprehended under hysteria and hypochondria. All hypochondria and hysteria. Everything is Psora. In short, thousands of tedious elements of humanity called by pathology by various names are, with few exceptions, true descendant of this many formed Psora alone. Who's writing this? Dr. Manish Yadav. No. Hahnemann. Dr. Samuel Hahnemann has written this about Psora. Now you see, now you will get the answer. Whenever you repertorize any case, sulfur always comes. Am I correct or no? Sulfur always comes. Isn't it? Always comes. And I still remember when I was a student, I used to ask my teachers, like, why sulfur always comes in the repertory sheet. So I used to get this answer that, oh, sulfur is well proved remedy. So it has got all the symptoms. Hence it always comes. So please exclude sulfur. Don't even think of sulfur. That was the answer I got. And I said, okay, yeah, he's right. My seniors are right. No, that's the problem. It is being well proved, mean it is affecting the entire economy, means sulfur is needed, the Psora is needed. You're giving totality, but in between you have to keep on giving anti-psoric. Now I'll come to the treatment part also. I'm not just going to share you the problem, but I'm going to share you the solution also. Hence, I realize, my God, if in my repertory sheet, let me give you a hint. I'm going to come to it, but I'm giving a hint about the treatment part. Now in my repertory sheet, if sulfur is coming again and again and in bold, it is a great hint for me that Psora is predominant in this patient. I'm not saying I will give sulfur to every patient. No. I'm not that fool. I'll give indicated drug and this and that, but I have in my mind that he might require sulfur. And if sulfur symptoms are more, Psora symptoms are, I might start my case with Psora, the sulfur, or in between I can keep giving intermittently. Similarly, I repertorize my case and mercury is coming very prominent as a third, fourth remedy. I might not give mercury, but now with this understanding, I know the greatest understanding that I have got about these miasm is that whatever I see is not true. What I do not see might be the truth. Are you getting my point? Like crime movies, if you have seen the thriller movies, what do you see? Sometimes it is facade, just to mislead you, but there is a lot of things behind it that is hidden. So every patient who comes to you is actually coming with a lot of hidden things. What do you think? Your patient is not eating paracetamol, diclofenac, Voveron. She's not coming to you and not eating hormone tablets. She's not taking antibiotics. She got eruption somewhere and she has not suppressed it. What do you think? You have no idea. And patients don't talk about this. They rather forget about these things. Hence, now when I see patient, I don't see just as totality. I see at a complete view, because what I'm seeing could be misleading. There could be something behind. So in my repertory sheet again, if suppose thuja is coming, nitric acid is coming, maybe I will keep that in mind and I will start investigating after I have found out my indicated drug. Is there psychosis in the background? Is there any other intercurrents in the background? Because through my whatever practice I have got, and I'm thankful for God to giving me all failures in my life initially, so that I could see the real picture. I have understood that sorry to say, but you know, the one remedy you give and the patient is better for lifelong, it is a false. It does not happen in the practice. You can be very lucky to get a similimum which matches everything and the patient is done with it. But in the clinical practice, there are a lot of changes of remedies and a lot of phenomena and things keep changing. So you have to be very vigilant and keep a watch in every follow-up. That's how you will become a good homeopath. Okay, maybe I'm drifting, so let me come back. How was this? How was this information whichever I shared? Now I'm going to come back to some other aspects. So what do you think? I want some opinions, right? I want something. Was it something new? Something surprise? Yeah, okay. Do you find this is practically useful? Great, great, great. Slightly confused. Okay. Confusion is the first step towards clarity. So congratulations, madam. Great. Okay. I hope now you will get motivated to read, the documents that I have suggested. Because I'm here to just give you a small presentation. I'm not here to go in depth in the study of it. And nobody can do that. You only have to do it. Let us come to the treatment. Treatment of miasms. Okay, before I come to that, before I come to that, I hope you understand that everything is Psora. He says everything is Psora. So now my life is actually easy. You know why? Because now I just need to understand what is psychosis and what is syphilis symptoms. What is psychosis and syphilis phenomena? What are their pathophysiologies? If I understand that thing, if I really understand that thing, excluding that everything is Psora. That's what Hahnemann says. Can it be said that if we consider psycho and syphilis, then Psora must be in the background? Yes, it can be said. Yeah. So I'm coming to it. Let us see what he says about cure. We now proceed to a medical homeopathic treatment of illimitably large number of chronic diseases, which after above gained knowledge of their threefold nature has not indeed become easy, but what without his knowledge was become impossible has become possible. There is one book, Rima Handley. I will write it down. Let me see if I can. Okay, I can't write it. Okay, I can write it down. Rima. The spelling mistake can be there. Rima Handley. The book's name is Last Letters of Hahnemann. Last Letters of Hahnemann. And you should actually go and read that book. You will be astonished that Hahnemann, this was a book written by Rima Handley, who was a student, who was a doctor, who was working with Hahnemann in his last days, in his end days. And she has written the way Hahnemann used to prescribe in his end days, end of his life. And you will be surprised Almost every patient he used to give sulfur. Almost. Please go and read. Before, after, sometime he used to give sulfur. Why? Was he fool? He was Hahnemann. Because in his end age he realized, oh my god, the entire life what I am doing is just looking at the superficial thing, that the deep aspects I'm not able to understand. He realized the fountain, the example of fountain that I gave, he realized there is something back. I'm not able to look at that. I have to target that. Let me do that. I'm not saying start giving sulfur to every patient. I'm not saying that. But try and understand. Try and understand. These things are hidden, right? These things are never brought out or never talked about. We as a young homeopath should go and read all those things. You don't know what will happen to your practice, what will happen to the way you start thinking about the cases. Great. Sorry, I in between, I get passionate and I just drift sometime. I become emotional, but that's how I am, so no problem. So now he says, since the homeopathic specific remedies for each one of these three different miasms have in great part been discovered. So what is it? Let us understand. Psychosis. So he says, if you have a psychosis, okay, I'm getting tired reading. Maybe you can read this. So for psychosis, this is a treatment he says. So he says give thuja, and he also says how to give it. The method also he describes, and then he says that we need to give thuja and nitric acid generally for psychosis as an intercurrent. When you're battling, you have to give thuja and nitric acid. Also about psychosis, you have to understand one thing, that psychosis in today's world, almost 80% patients are psychosis. How? Why? Because of the lifestyle, because the way we have been working. Just imagine when you were in college, how were you? Lean, thin. And when you see the same guy after 10 years, 20 years, how is he? Obese, fat, all those. Psychosis comes in picture. The lifestyle, the attitude. And it is also said that psychosis takes long time to develop, and it cannot go like this. It cannot go fast. It will go slowly and steadily. So the message is very simple. If there is a psychotic patient, you have to counsel and you have to understand in your mind that miracle is not going to happen. It's going to take its own time, slowly, because psychosis is, in a way, stasis. The things that they say, stasis and whatever. It takes time to develop in a way. And the lifestyle that we are living in, that also adds, if you know the fundamental and the maintaining cause that Hahnemann talks about in Organon. So I am maintaining burgers, pizza, lifestyle. Of course, lockdown has taken care of all those things, but still, we have those lifestyles in our picture. Great. You got the answer for psychosis. Syphilis, what he says? Mercury. So mercury is the remedy. He says that if syphilitic thing is there a lot, then you give mercury as an intercurrent. What is degradation? I don't know what is degradation. I don't know the meaning of degradation. Somebody has written degradation are often the best way to learn important things. Okay, I'll Google it. Okay. So he says for syphilis, you give mercury. Okay. Now, let me give you again a hint. I, of course, told you in my previous talk. Speaking about seemingly unrelated. Okay. In your repertory sheet, you're giving a remedy, but mercury is coming third, fourth, third, fourth, third, fourth. You have to become conscious that maybe syphilis history could be there. Are you getting my point? So what I will do is that I will go back and start looking at the past history and the family history. So for syphilis, what are the features that I will look for? Can somebody write down what are the features that I'm going to look for? If I have to stamp that yes, syphilis is in the background. UTI, no. UTI is for psychosis. Heart, brain, heart disease, stroke, burning. Okay, that is throat is okay. Throat, depressed, bridge nose, paralysis, CV. Very good, very good, very good. And many more. The night aggravates and all those. So I will start looking at in the background and see what is happening. Maybe I will get, oh my God, he's a carrier of syphilis. So I know in my mind that maybe I'm giving constitutional drug, but as the patient moves on, there will be a lot of trouble. I will need anti-syphilitic remedies. So mercury was the best choice by Hahnemann. But you have other remedies also. You have got syphilinum. Of course, I'm going to talk about that. But I'm just telling you exactly what do you say? Exactly, I'm talking about the treatment that Hahnemann said. Exostosis is Psora. Okay. You'll have to look into it. Mostly it is syphilis, no? Generally. Okay. Psora has everything there. Psora is everything. Right? So Psora. Now look at this Psora. Now you know what is Psora? How dangerous it is. So if an enemy is dangerous, let me give you an example. You know, there are a lot of foreigners here, but of course they will also understand, and especially Indians will understand this better. We have got two enemies. In a way, you know, I'm just talking about a political scenario. You know that we have got two enemies. One is one is one is Pakistan and one is China. Just an example, okay? Don't take it seriously to your heart, but just an example. We have got two enemies we are being surrounded by. One is suppose Pakistan and one is China. Now which is the dangerous one? Actually, yeah, the China is a dangerous one. A big country, big infrastructure, bigger than us, stronger than us. It can engulf the entire India. It can do anything. So the treatment that you're going to give to China, the way you're going to tackle China, and the way you're going to tackle Pakistan is going to be different or the same. Yeah, it's going to be different because to tackle the bigger enemy, you need bigger diplomacy. You need bigger things, not just one way action. But the smaller one, this one way action can hit him and it can get destroyed. So for psychosis and syphilis, he given, you give Baba this, you give syphilinum, you give mercury, you give thuja, nitric acid. That's it. That's what Hahnemann says. But now we know Psora, the bigger problem. Now what he says, if Psora is predominant, what do you need to do? Every other psoric diathosis, the Psora that is still latent within, as well as Psora that has developed into one of innumerable chronic diseases springing from it, is very seldom means rarely, is very seldom or rarely cured by any single anti-psoric remedy, but requires the use of several of these remedies. So your first idea, single remedy, single dose, it drops down. Hahnemann says it will not work. To tackle Psora, you will need series of psoric remedies, anti-psoric remedies, one by one, one by one, one by one, one by one, because that's the way you can tackle it. You cannot one remedy you give and the miracle will happen. It never happens like that. Rarely it happens. And then he says, in the worst cases, the use of quite number of them, one after the another, one after the another, for its, for its, for its, for its perfect cure. So if you're battling with the worst cases, you need one by one, back to back, back to back, back to back, many, many, many remedies, series of remedies. That's why when you read Burnett, you'll see ladder of remedies he talks about, different remedies he talks about. He says Psora is a big monster. You'll have to give many remedies, series of anti-psoric remedies, one after the another, one after the another. You know, in every follow-up, new symptoms will come up maybe. And that's the way you can really fight this monster. I know few of you might be shocked, surprised, something different I'm talking about. But my dear friends, it's not my invention, my discovery. It's all Hahnemann. So whatever you have to say, please talk to Hahnemann and say, why did you say this? This is practical. This is the way the cases are being solved. Let's go ahead. Oh, he doesn't stop. Then he says, nevertheless, in very tedious and complex cases which are mostly such as have been mismanaged by allopathic treatment. Complex cases. What are complex cases? Let me give example. COVID is going on, right? A lot of doctors might be getting COVID patients. I'm also handling a lot of patients. I get phone calls and different people, they approach me. And it's not just me. A lot of homeopaths are silently working with these patients. And one of the problem, I'm just taking COVID example, but it is an example. Let's take an example of viral disease. Let's not call it COVID. In viral disease, when a patient comes with you viral fever and this and that, the biggest problem that you suffer, you know what? He gets fever, he takes paracetamol, he takes antibiotics 3, 4, 5 days, 7 days, and then comes to you. And he says, please give me some remedy, I'm not better. What is a homeopath gonna do? He gets no symptoms. Why? Because when the symptoms were developing, he took paracetamol, he took antibiotics. I will not get, he suppressed it. How will I get the totality? And if I do not get the totality, how do I prescribe? What do I prescribe? So this I talked about acute, but also in chronic cases. Generally, patients come to us in chronic cases after taking so many antibiotics, so many tablets, years, 10 years, 12 years they have been taking. Iatrogenic disease, somebody has. Yes, true. So he says, when you are battling those kinds of cases, don't think that you have taken a case, wonderful case, given one remedy and magic is going to happen. Next follow-up, the patient is going to come and say, thank you, doctor. What a doctor you are. It doesn't happen like that. People who are practicing know where the shoe is pinching. Patient comes and says, doctor, what medicine you gave? 2 months have gone. I'm not feeling much better. Does it happen with you or no? Or all your cases are wonderfully cured? Say yes or no. Does it happen with you? Yeah, that's the fact. That's the fact. Nobody's going to talk about that. We have been always shown the great cases, the great cures, but nobody talks about failures and daily routine practice problems. And the poor homeopath is scratching his head and thinking, oh my God, maybe my homeopathy is not good. Maybe my Mathematics is not good. Maybe my understanding is not good. He keeps on sabotaging his self-image all the time. But nobody talks about where the problem is, where to look for. And we keep on taking retakes and retakes. I'm not saying retakes are not important. I'm not saying individualization is not important. Don't take me wrong. I am saying when you are not getting results out of that, then don't you think you have to look sideways and see if there's some other avenues to tackle it? Yeah. So Sora, he says, the complex and tedious cases, especially mismanaged by allopathic treatment, what should you do? It is nearly always necessary to give again from time to time during the treatment. What he says, to give again from time to time during the treatment a dose of sulfur or heparsulf according to the symptoms. Are you understanding what's happening now? I hope some of you must be getting your answers. My patients keep coming. What do I do? Not getting better. What do I do? My individual remedy is not right. My constitutional remedy is not right. No, dear, that might be right. You have really done good. But maybe this is the aspect that you're not being able to tackle it. So once you understand this aspect, once you understand how to trace it, you will find a lot of great results in your general practice. I hope it makes sense. Please say yes or no. Yeah, good. By the way, I'm really loving this lecture because all the participants are very intelligent, and the way you're being interacting, I'm loving it, right? So thank you very much, for engaging, because this lecture wouldn't have been so interesting if you wouldn't be engaged, right? So great. Thank you. Let's go ahead. Ooh, now we come to this thing. I was wondering, yeah, so this should be when we consider Sora only. Yes, when you see Sora manifestations a lot, then. So he gives heparsulf and sulfur. So you know the difference, right? Sulfur is hot, hepar is chilly. Even sorinum is also one of the remedy. I will come to it, okay? But let's look at this. But your question is right. Dr. Rachna Raval. Good. Now, what about trimasmatic remedy? Patients do not come to you just, patient comes and says, oh doctor, I am Sora, I'm psychosis. Oh, I'm only syphilis. No. You will see a lot of miasms intermingled actually. You will see some patients, hence it becomes confusing. And generally, a lot of patients come with trimasmatic psychosis. Also, you will see, syphilis also. Sora, so is always there. Sora is never gone, right? So now, what do we do? Let us see what he says. Then it is necessary. Listen carefully. Then it is necessary to first to come to the assistance of the most affected part, which is Sora, with specific anti-soric remedies. He says if you get these cases where it is complex and trimasmatic kind of thing, so like again I will give you an example. He says if suppose a small country and a big country attacks you, a small problem and a big problem attacks you, which problem you're going to face and annihilate first? Tell me. Small. Okay. Big one, not small one. Small problems you can handle maybe. The bigger one is the problem. Bigger one is the problematic thing, isn't it? So there are two people who are attacking you. One person can, just scratch you, and one person can kill you. Who are you going to fight first? The person who can kill you. Are you getting my point? So here, which is the problematic thing? Psora, syphilis, psychosis. He says that in trimasmatic, Psora is the bigger problem. So first tackle Psora. First tackle Psora. Give some anti-miasmatic remedy, anti-psoric drugs. Give first that. And then make use of remedies of psychosis. If psychosis is there, then make use of psychosis. And then he says, before a proper dose of best preparation of mercury. Ooh, what has Hahnemann said? My God. So Hahnemann says that if you get a trimasmatic drug picture, so first tackle Psora. Psora. Then if psychosis is also there, then tackle psychosis. Give antipsychotic drugs. And then dear come to syphilitic drugs. So now if suppose I give you, it is not trimasmatic, it is bimasmatic. Psychosis is not there and Psora and syphilis is predominant. So what do you do according to Hahnemann? A patient comes to you, all syphilitic manifestation, and Psora is also there in big sense. You give Psora first, you give sulfur or hepar or whatever, and then you give syphilis. But what were we taught? What were we taught? We were taught, oh my God, the bigger problem is syphilis. Psora, then syphilis. Psora, psychosis, syphilis. That's how it goes. So it could be Psora psychosis or Psora syphilis, or it could be Psora psychosis syphilis. So depending on the symptoms, the message is that look for Psora, treat the Psora. I don't know about the stage, which stage it has to go. Nobody has said, never it is ever written. Somebody has written a question that if it has to go to syphilitic stage, it has to go to psychotic stage and then syphilis. That's what I'm trying to explain you. That never it has said that first you will get Psora, then psychosis, then syphilis. It's never like that. It is the inheritance pattern. You don't know from miasm, from where miasm is coming. It is from your forefathers. The miasm is coming. That's what we are tackling it. Are you getting my point? And it is not the disease. We are talking about the dynamic influence, the virulence. It is said the virulence of those affections is being carried forward. It's like this. Husband and a wife, a male and female, come together, they get married. He has his own genetic, the male has his own genetic predispositions, and the female has his own genetic predispositions, anti-miasmatic thing. They come, and then a child is born. The child is a mixture of both, and whichever is prominent at that time will transfer. It can get transferred. I don't want to make you confused, but that's how it happens. And now the child is there with another combination. He gets married to another lady, another child. Are you understanding? So whichever is prominent at that moment, that will be passed on to the next and the next and the next generation. So we have no idea actually what we have been carrying from our genetics, as it is dynamic, right? You can say a sort of dominant gene expression, yeah. But for our understanding, we should look for the symptoms, the pathophysiology, the past and the present history, and totality of symptom. This will help you. Let's go to okay. Yeah. And the same alternating treatment may be continued until the cure is affected. And he says you have to don't stop in those trimasmatic things. So you give Psora, psychosis, syphilis. Then after a few while, again you have to repeat the cycle. And hence you will be able to cure. Probably cure is such a relative term. I don't know cure, but at least you'll be able to give lot of good relief. to them. And then he says only in one of these three kinds of medicine must be given a proper time. Of course, you have to give proper time. You should not repeat it fast, 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 but give proper time to complete the action. Okay, I'll come to this part, but hereditary hypertension and diabetes come under which part? Okay. Generally, what I think is diabetes is modern day medicine, right? Sorry, modern day disease. So diabetes, looking at the manifestations, where it is being affecting, right? If it is causing the damage, the tertiary symptoms, right? Maybe you can think of syphilis, but generally psychosis and Psora is there. So I cannot opine on this. Okay, let me give you one example. What I'm trying to say is that hypertension is this miasm, diabetes is this miasm. This is a wrong way of understanding. Yeah, somebody has written nicely. Think expression will decide which miasm. Very right. So it is the patient's expression will decide which miasm. Let me give you one example. I've been handling one case, and it's a very bad case. Okay, I'll not go into the deep case, but I've seen a lot of syphilitic manifestation in that case. Okay, entire family I've been treating. Okay, they've been syphilitic in their nature, syphilitic in their occupation, the kinds of work that they do. A lot of people died with heart attacks, strokes, multitude, no, matlab 4, 5, 6. So syphilis is very strong in that. And this patient, he has hemorrhage. He has got, eyes get damaged and then multiple hemorrhage starts. He's got diabetes, hereditary diabetes. Now, I was not able to understand how to tackle his hypertension, because one of the biggest problem which I was facing was his uncontrolled hypertension. His hypertension used to increase, and then bleeding used to happen in his eyes. So there are a lot of remedies like, Thalaspi bursa pectoris, millifolium. I used to control the bleeding part, but his hypertension troubled me. Okay, and he was taking antihypertensive and all those things. Later, when looking at the patient's case, and when I went back into the past history and then family history, I got a clear understanding that syphilis is full-blown syphilis is there. And then afterwards, what happened is that I asked him that you please monitor your blood pressure in a day 3 times, at least, and let's see when it is rising. And it was, what happened was, the blood pressure used to rise only in the night. Evening 8, 9 o'clock, the blood pressure used to shoot up 180, 110, and morning used to get the bleeding. That was the phenomena which was going up. Now, what do you think? What should I do now? Which miasm? Sorry, forget what I will do. Which miasm? This patient, syphilis. Yeah. So syphilis is full blown in this case. So of course I was giving lot of I had already given a lot of antisoric remedies depending on his totality and everything. But then when this phenomena was full blown, and then I had to give antisyphilitic drug. So I started with syphilinum. I started giving him syphilinum every night, then 3 days, 4 days. In between, I kept on repeating, and now the patient is doing really good. His blood pressure is controlled. Controlling uncontrolled blood pressure is such a big task. But I could not have been able to control it and make him better until I would have understood the phenomena and the manifestations of these miasmas, written by Hahnemann. Yeah, you can think of mercury also. No problem. You have to just differentiate between them. Why I gave syphilinum was because to give mercury, at least I should get salivation and teeth caries. All those symptoms were not there. So I said maybe I'll give syphilinum. But you can give mercury also. No problem with that. Okay. So let us go ahead. Now we have got 10 minutes, so let me see how much I can finish. These are some remedies. Now we don't have to stop till syphilis, psora, and psychosis. We have a lot of other things. We have got tuberculosis in picture. We have got carcinosin in picture. Now you get a patient with carcinosin, like cancer, strong history of cancer, strong history of cancer. Maybe carcinosin could be an intercurrent drug, anti-miasmatic drug. Tuberculosis, I already talked to you about tuberculosis. Tuberculosis could be one of the uh, remedy, right? Oh, okay, okay. I think okay. Forget this one. Yes. Somebody asked in this case, Psora is in the background. So already I gave Psora. First you have to tackle with Psora. Then you come to syphilis, according to Hahnemann. Psora means not only sulfur, but even the totality when you take, a lot of antisoric remedies come in picture. That's what you give. So these are two origins of states. If you can see, inherited and acquired. What is inherited? Inherited is which you get from the family, and acquired is generally the past history. You get infected, you get exposed to the bacteria, you get vaccination, you get introduced to some other substance. So these two states, these two ways you get your original states, and that's how you have to tackle it. So inherited state, carcinosin, tuberculinum, sorinum, medurinum, even thyroidinum can be one of the drugs. All those nosodes which you have, that can be there, right? Even infections, right? Don't look at the injury and operation part, just look at this. Acquired state. Now, what is acquired state? If there is history of pneumonia, he might need pneumococcinum. He might need. Yeah, I will show you the remedy slide again. If there is a history of streptococcal infection, he might need streptococcinum. If there is history of ringworm, he might need ringworm also as an intercurrent. Let me give an example of streptococcinum. You might be getting some patients, who get recurrent throat infection, pain, infection, pain, and we give heparsol, we give belladonna. It recurs. Try streptococcinum, because which is the organism which affects the throat? Streptococcinum, not staphylo, streptococcinum. So on that understanding also, you can prescribe streptococcinum, and streptococcinum has got wonderful results in recurrent throat infections. Recurrent, if you're tackling with that, right? So I hope you understand, right? Inherited, acquired. Now what you can do is that you can widen your horizon. That's what is my next ending. Like I want to end it with that. So now we don't have to stop potency. I'm telling you don't have to stop at psora, syphilis, and psychosis. You have to understand the way Hahnemann worked and Hahnemann looked at the diseases. You have to get the mindset, and then in the present scenario, you have to look at the diseases and the way they manifest. If Hahnemann was alive till now, he would have given more miasms into picture. So all the nosodes can be of great help. I'm just giving you some hints. All the nosodes, it could be of great help to you in your practice. Typhoidinum, pneumococcinum, streptococcinum, staphylococcinum, and number of things are there. But the first thing that you need to understand is psora, syphilis, psychosis according to Hahnemann. Now we come to a part of potency. A lot of people ask potency. Or an intercurrent drug. Whenever you are giving a drug as an intercurrent, you give high potency. You give high potency. Maybe I'm writing it down. All nosodes should be given in high potency. 1m, 10m, maybe cm. If I am giving Tuja as a specific, suppose for watt or something, very specific, or on totality, I might give 30-200. But when I'm giving Tuja or Medorinum or carcinosin as an antipsychotic indications or anti-miasmatic indications, I will give always high potency. The NOSODs should always be prescribed on high potency, period. Who says? Alan. Carcinosin, boric advises to go to 200, 30 and 200. See, boric, you have to understand boric. When boric is talking about the remedy, he is not talking from an angle of anti-miasmatics. He is talking from an angle of drugs, specific drugs. If you read the preface of boric, he says specific disease, specific drugs he is giving. And he was a old prescriber, so it was almost specific that this disease, this symptom, give this drug. Hence, you will find in boric, low potencies are given. So as a drug, you can use it, but for miasmatic things, right, when you're using, like carcinosin you're using, generally you should give 1m, 10m. Why 1m, 10m? The reason is very simple. It's a big problem, not big enemy. So you cannot kill him with pistol. You need big weapons, and our weapon is potency. When we say big problem, means with big dynamic problem. So big dynamic problem needs higher potency, not the lower potency. I hope Dr. Rachna, it answers your question. Single dose or repetition dose? Okay, the dose you can give single dose or you can repeat. It's on your will. Okay, it's on your will, no problem. But generally what I do is that I use plussing method. Plussing method, that really works good. Plussing method. So yeah, somebody said Tyler says 30-200 1m ascending potency. Yes, you can use that, no problem. You can use that. Sulfur can be given in LM potency. Yes, it can be given. Please explain the method of plussing. Okay. So in general, not as intercurrent, which potency is high and which potency is low. Generally, low potencies generally mean below than 30. If you read the literatures, below 30, for them 30 was also high potency. But in our terms, 1m, 10m is high potency. Below that, I think it is a low potency, 30, 200. How long should we wait after the intercurrent? Yes, how long should we wait? Very good question. When the next remedy comes, when the next remedy has to be given, very simple. You will never prescribe any drug until unless the symptoms develop. Once you have given a remedy and patient is feeling better or status quo, do not give a remedy until a new symptom comes up. That's the principle of organon in any cases. So in follow-ups, when patient keeps coming and there are no changes, stable, patient is stable, not better, better, I will not change it until the new symptom comes. And generally it is seen that whenever you give intercurrent and NOSODs, what happens is that the intercurrent remedies never cure. Remember that. It will never cure the patient, but it will go and destroy, it will go and cause a disturbance. And that disturbance leads to some acute disease or some new symptoms develop. I've seen this almost all the time. Okay. Great. Somebody was asking about the acquired state slide. This is the acquired state. Don't look at this injury part and all these things. Acquired state means, I can explain you orally. Acquired state is very simple. The infections and the bacteria that you get, the bacterial diseases that you get. So if you're giving the remedies and it is not getting better, maybe the nosodes you can use. For example, suppose you get a pneumonia patient. You're giving your phosphorus and other things, it's not getting settled, or it is getting partially settled. Maybe you look for the past history. If there's a tuberculosis, maybe bacillinum can be used. If it is not there, maybe you can think of pneumococcinum. And a lot of literatures are there. If you can read, you can open pneumococcinum, you can read the cases, how it has been used by, by our stalwarts. You'll get the answer. Disease everybody fears. Now the questions are going in all different ways. What do you mean by nosocomial infection? Okay. So I think I'm done with it. There can be a lot of more things. I don't want to confuse you. Hospital acquired, yes. Okay. You can prescribe. Definitely you can prescribe. That's what it is, right? You can prescribe. Sir, one of my patients is under treatment, PCOD. Her PCOD was clear, but since 3 days, complaining of pain today. Why USG? Yes. If you do not get any symptoms, if you do not get characteristic symptoms, the modality and sensation and everything, then you can think of giving medorinum to your OCD patient, Dr. Afshana Ansari. You can think of that. What about bowel nosodes? Stop. Let's stop. Let's stop. So my topic was to make you understand the old basic miasms, Psora, psychosis, and syphilis, and then it give you a little idea so that it opens your mind. So you can ask me a lot of questions, but it is not going to help you. What's going to help you is that whatever I talk today, just engulf it basically, engulf this, get this idea, go back. You know everything. Your brain is similarly strong than everybody else. Open chronic disease, start reading. I know it is boring, very boring, but I think with my examples, it will make it easy. And not every good things are exciting. That's how you have to read a lot of things. And then please read Alan's miasm. These two books will give you a lot of insights, and a lot of thoughts will start coming in your mind. And then of course it is your own research which you go ahead and do. So thank you very much, and